The Harris Poll survey found that 68% of Americans are worried that the worker shortage in healthcare could have an impact on their own health. Joining us now to discuss is the president and chair of the American Academy of Physician Associates, Folosho Ogunfiditimi. Did I say that right, sir? I'd like you pronounce that for us, for all of us.
That's very good. It's Folosho Ogunfiditimi.
Man, that is such a cool name. I love that name. All right, so how is the worker shortage in healthcare impacting Americans' access to care?
So that's a very good question. Access to care is a major challenge for our patients. It's resulting in them being frustrated and anxious because of the challenges that they're seeing in terms of accessing care. The recent poll you just stated suggests that 75% of patients believe that their healthcare needs are not currently being met. Another 25% or so believe that are giving the healthcare system a failing grade. This is extremely concerning as it relates to being able to come in to be able to be seen in our clinics. On average, for example, patients are spending about 4 weeks or so before they can get an appointment to come and see a healthcare provider or to come and see me as a PA. And that's simply too long to be able to receive the care that they need.
I agree. That is a little bit too long. So can you discuss some of the additional findings from the recent Harris Poll survey?
Yes, so the findings were illuminating. Some of the findings included concerns around increased costs, delays in being able to see a provider, as I just mentioned, but also critically about the challenges with health disparities. The good news is, though, that PAs do and can be a solution towards addressing those healthcare challenges. PAs typically are available to be able to close those gaps, and as a clinical PA for over 25 years, it's extremely important that we are part of those solutions. About 40% of adults believe over the past 2 years have either skipped or delayed care, and another 60% or so have waited till they actually fell sick before coming in to be seen. This is simply not a way in which we want to be able to deliver care in the United States today, and PAs can add to that challenge and solution by improving access to care.
Excellent. And so how can physician associates or PAs such as yourself help alleviate some of the issues Americans face when it comes to accessing health care?
Right. So as one of the fastest growing professions in healthcare today, PAs can have a positive and lasting impact on patient care. And it's extremely gratifying by looking at the results of this survey to suggest that patients recognize that PAs have a value towards addressing the shortages from a patient access standpoint. Over 90% of patients believe that PAs can be a solution, and over 90% also believe that PAs can decrease the access, increase the access to care rather, as well as ensure that we are having more ability to be able to make those clinical appointments.
That's very interesting. And so are there any obstacles that are making the care shortage even more severe?
Yeah, there are many obstacles. One particular challenge is that PA practice varies from state to state. And unfortunately, some of the state laws currently don't match up to where our healthcare needs are today. PAs are advocating to modernize PA practice laws so that PAs can practice to the top of their education, experience, and knowledge from that standpoint. PAs work as part of the clinical team, and we want to be able to ensure that we are doing everything we can to be able to improve access to care, decrease those wait times that we had mentioned before, and ensure that we are part of the solution towards the overall healthcare shortage that we see in the United States today.
This has been a very interesting conversation. I really appreciate you being on with us today. So where can folks go if they want to learn some more information?
Yeah, please go to aapa.org/patient experience to learn more about what PAs do and how we can continue to be a solution towards the healthcare shortages that we see in the United States today.
Fantastic. Thanks again for joining us. And guys, you know you can watch this segment again by heading over to our website.